I'm Dr. Ash Patel from Albany Medical College in Albany, New York. I'll be discussing the study, Reconstructive Surgeons as Essential Operative Consultants, Quantifying the True Value of Plastic Surgeons to an Academic Medical Center by Dr. Patel and colleagues from the University of Southern California. What do plastic surgeons do? How can plastic surgery benefit an academic medical center? An academic medical center is a hospital that cares for the most complex patients and performs research, education, and innovates in healthcare. Plastic surgeons at academic medical centers are often involved in the delivery of complex reconstructive surgery, particularly in collaboration with other surgical specialties. In this study, the authors evaluated their hospital's revenue for surgical procedures to quantify the financial value related to plastic surgery involvement. They examined procedures with specialties that plastic surgery could be involved with, including general, vascular, and cardiac surgery, neurosurgery, orthopedics, ENT, and urology. Some of these procedures had planned plastic surgery involvement, whereas others were unplanned. The authors also determined if plastic surgery involvement was integral or necessary for the completion of the operation. They found that almost 3% of procedures performed in their institution involved plastic surgery. Most commonly combined procedures were with neurosurgery, orthopedics, and general surgery. Hospital revenue for cases involving plastic surgery was 1.8 times higher than for cases that did not involve plastic surgeons, with the greatest difference seen in combined procedures with cardiac surgery and neurosurgery. Procedures involving only plastic surgeons did not generate greater revenue than cases only involving other surgical specialties. This suggests that the combined procedures involving more complex care were of financial importance to the hospital. So what kind of conditions required plastic surgery involvement? The most frequent reasons for plastic surgery consultation were for back or scalp defects with neurosurgery, with orthopedic surgery to perform complex reconstruction over implanted hardware, and abdominal or chest reconstruction. These procedures all commonly involve performing flaps. A flap is where living tissue is moved to a different location on the body, maintaining its blood supply and allowing for a complex defect to be reconstructed. This tissue commonly involves either muscle, skin, or a combination of both, and plastic surgery techniques involve flap reconstruction around the entire body. 89% of procedures involving plastic surgery in this study were planned, with this percentage being slightly higher with orthopedic surgery. The authors determined that in 78% of procedures involving plastic surgery, the plastic surgery involvement was integral to the completion of the surgery. This indicates that plastic surgery consultation was necessary and important for the patient's care. The patient may have had a worse outcome or not had the same procedure performed without plastic surgery involvement. The authors' findings build on existing studies that show the value of plastic surgeons in providing complex surgical care. Plastic surgeons have unique and specialized skills that allow for the treatment of devastating defects and the management of surgical complications. The availability of plastic surgeons expands the overall complexity of the patients the hospital can safely manage. While plastic surgeons are often consulted to help manage surgical complications, this study did not evaluate how plastic surgeons can decrease the hospital length of stay or overall costs associated with salvaging complications. Another disadvantage of this study is that results may not be entirely applicable to other hospitals due to the mixture of cases being performed, types of cases being performed by each surgical specialty, and how the hospital performs its accounting. Prospective patients should be aware that the involvement of a plastic surgery team with their primary surgical team may be necessary to provide the best outcome, especially for complex conditions. And hospital leadership should be aware of the importance of reconstructive surgeons for both patient care and hospital finances.